No, no, it's fine.
这个果冻很好赚的，果冻。什么？摸到了没？然后你看它在哪里，对呀，不穿嘛了。对啦，要不我的小手手吗？不我的小手手，借我的小手，不我的小手手。
So I think we had a question on deep bites, open bites, as well as bimax cases. So again, if you remember, what I tried to explain is one, the position of the screws. So ideally, when you look at this from the wire, this is roughly about 8 millimeters height from the wires. So this brings you closest to the level of the center of resistance. For the molars, normally the center of resistance is just at the point of trifurcation into the roots. So we try and keep the mini screws at this height. Also clinically, if you want to check, this normally lies within the attached gingiva. It doesn't go to the free gingival margin. So once this goes to the free gingival margin, you can see that will go to the buccal soft tissues, which move a lot during our daily function. So it just causes the screw to lose primary stability. So as much as possible, try and not vary the position of the screws. When we want to have vertical corrections, we normally go in with correction using the height of the hooks. So let's say you have a bimaxillary patient. Most bimaxillary patients, you don't have deep bites. There is usually a higher tendency of open bites. So that is one thing. We try to level first. So in bimaxillary patients, if there is no vertical problem, you can keep the hook at the same height as the screw, where both are at the level of center of resistance. So what you get is only bodily movement, which means you only get retraction, you don't get vertical correction, you don't get intrusion, you don't get extrusion. Fine? Then we have another scenario where you have an open bite tendency now. So it can be an open bite with a class 2, it can be an open bite with a bimaxillary patient. So in these patients, normally, one, when you place the screw here, now our hook height traditionally should be higher. So what happens here is, now when you try to retract this will have a retractive movement, plus because your hook is above the level of the screw, you also get extrusive movements here. So this normally is favorable for open bites, but what we also do is, when you have an open bite case, if you're trying to do this, we also normally try to put a power chain here, or we try to intrude the molar here, because you also want counterclockwise rotation of the mandible. Because if you remember, I told you, if you only extrude the anteriors, it doesn't make it very stable. So if your anteriors extrude, your open bite closes, but again, after diastemas, the second highest rate of relapse is open bites, because most times we just go with anterior extrusion. So what we want is, one, we try to retract. If we have here, we also get some amount of extrusion here, but we also try to do compensatory intrusion here so that our curve of P or our occlusal plane will flatten faster. So our open bite, whenever you look at open bites, you will normally notice your lower occlusal plane is flat, but your upper occlusal plane is like this, which means these are your anteriors, and this is your first molar, second molar, third molar. So normally the first molar is extruded. So what we want is intrusion of the molar and little bit extrusion of the anteriors so that we can correct the occlusal plane. So this is in open bites. This is normal bite, and then we have deep bite cases. So I think I showed you an image before during the correction as well. For deep bites again, our screw height remains the same. Now we go with a smaller hook this time. So depending on how deep your bite is, you can keep on making the hook smaller. So let's say if it's, you want, now it depends on how much of intrusion you want. So let's say this is, if the space is between 2 millimeters, you get 2 millimeters of retraction and intrusion. You can keep on going slower. So the more the gap between here and the screw, you also get retraction and intrusion at the same time. Again, this is only going to solve part of the problem, because in this case you're again trying to intrude the anteriors only, which helps in a false deep bite case. If it's a true deep bite, you also need to correct the other problem. So in deep bites it's the opposite, where your upper occlusal plane is flat but lower curve of P is deep. So what you want here is lower anterior intrusion, lower posterior extrusion. So that is the reason why we put bite planes, so that we can level the lower curve of P. Then after that, if you still have residual deep bites, if you have extraction spaces, now you've removed your 4, now is when you decide that you want to retract and intrude. Does that help? So this is how we decide normally what kind of hooks to use. We don't vary the screw sizes usually. We try to vary around the sizes of the hooks to change the direction in which we retract. So we can try and control whether we want retraction alone, retraction with intrusion, retraction with extrusion.